Hi, this is Neil from singlebestanswer.com. Head over to our website where you will find a dedicated UK MLA exam resource tailored to your revision. Everything on this website is dedicated purely to help you pass the UK MLA exam. We will track your progress over time, and we can assure you that every area of the GMC curriculum has been covered, as we have based this entire exam resource on their curriculum. Today I'm going to help you with a specific question on cardiovascular and specifically cardiology. So we'll go straight to the question, which is about a 78-year-old man found collapsed at home. He is confused and appears dehydrated. He does not have a temperature but has a fast heart rate and a slightly low blood pressure. He does have some glucose and blood and protein in the urine, and he has some ECG findings. The question that we're being asked is what the most initial treatment is for this man. Now, I don't know whether you picked up on the massive red flag in this history, but this is it right here. ECG showing tall T waves and widened QRS complexes. When you see that on an ECG or a description of that, it means the patient has potentially hyperkalemia, and that is a dangerous heart rhythm as it can lead to ventricular fibrillation. So the most appropriate initial treatment, I would say, without looking at the answers, is to try and stabilize the myocardium. And there is one agent in particular that we use to stabilize the myocardium, which is calcium gluconate. Thankfully, it appears on our options, but let's go through the other ones to see whether they would fit. Remember, we're looking for the best answer here. Amiodarone, well, that's a bit of an old-fashioned drug used for atrial fibrillation. That wouldn't really fit. He does have a fast heart rate, but there's nothing to describe AF here. Coamoxiclav is an antibiotic, of course, and he could have collapsed due to infection, but again, there are no definite pointers to infection. He's apyrexial. Sodium bicarbonate, we use that to treat metabolic acidosis. He may be in metabolic acidosis here, but we don't have an arterial blood gas to confirm that, so it wouldn't be my first choice. The sliding scale glucose or insulin is probably the major distractor here, and if you didn't know about tall T waves, you might be tempted to choose this, given the patient has glucose and blood and protein in the urine. He may have diabetes and be suffering from a diabetic coma, but you shouldn't choose this over calcium gluconate because of the ECG findings, and that's why B is the correct answer. Hopefully. Let's see. And yes, it is the right answer. If you want more of these or more in-depth explanations and links to online resources, head over to singlebestanswer.com, and I will see you in the next tutorial. Bye bye.